afternoon, everyone. The Labor, Industry, and Veterans and Military Affairs Finance and Policy Committee will come to order. I would like to announce that this meeting will take place in accordance with House Rule 10.01. This meeting may be viewed on House Public Information TV, which is available on the House website. As is custom with this committee, please rise for the Pledge of Allegiance. Pledge allegiance to the flag of the United States of America,
and to the republic
for which it stands, one nation, under God, indivisible, with liberty and justice for all. Ms. Doyle, will you take the roll?
Chair Eklund.
Present.
Vice Chair Zhang.
Present.
Representative Detmer.
Present.
Representative McDonald. Representative Berg.
Representative Berg present.
Representative Bliss. Representative Edelson.
Present.
Representative Frederick.
Present.
Representative Greenman.
Present.
Representative Nelson.
Present.
Representative Poston.
Present.
Representative Raleigh.
Raleigh present.
Representative Sundin.
Sundin present.
Representative McDonald. Representative Bliss. Okay, and we do have a quorum.
Thank you, Ms. Doyle. Quorum is present. Approval of minutes. Next on the agenda is approval of minutes from the January 13th, 2001 meeting. Every member should have received a copy of today's minutes in their inbox. Representative Detmer, would you care to move the meetings from minutes from January 13th, 2021?
I will do that.
Representative Detmer moves a minute. Thank you, Representative Detmer. Representative Detmer moves the minutes. Any comments? All in favor of the minutes, say aye.
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 Opposed say nay. Opposed say nay. Motion carries. Next on the item on our agenda will be a presentation from the Department of Military Affairs, Minnesota National Guard. Adjutant General Mankey, if I got your name wrong, General, I apologize. And Executive Director Donald Kerr from the Department of Military Affairs. Please identify yourself, gentlemen, for the record and proceed.
Hey, good afternoon, Chair. My name is Major General Sean Mankey. I'm the Adjutant General for the Minnesota National Guard. And Mr. Kerr, were you able to connect?
Good afternoon, Mr. Chair. Yes, General Mankey, I'm here. I'm just trying to figure out how to share my screen here, and then we'll be in business.
Okay.
While we're getting this set up, members, please remember to direct questions through the chair, and if possible, hold your questions till the end of the presentation, if that works. Mr. Kerr, whenever you're ready, go proceed.
And Mr. Chair and General Mankey, I think I'm sharing my screen.
Yep.
As I am, so I think we should be good.
Okay. All right. Mr. Chair, representatives, thank you for taking time this afternoon to listen to myself, and I'm going to tell you a little bit about the Minnesota National Guard. First and foremost, humbled to be appointed the 32nd Adjutant General of the Minnesota National Guard this past August, as General Jensen was selected to be the Director of the Army Guard. Just going to tell you a little bit about us and what we've been doing over the last year. Go ahead, next slide, please. So we are 13, just over 13,000 airmen and soldiers in the Minnesota National Guard. And we are training for our federal mission, which always allows us to do our state and our community mission. We're composed of a diverse organization of people where one of my priorities is people first. And here's an example of a young soldier at our youth camp during one of the summers pre-COVID. Next slide, please. Okay, so this is what we do. Bottom line is we train for our federal mission. Training for our federal mission allows us to be trained and ready for our state mission and our community mission. One of the benefits of serving in the Minnesota National Guard, not only do we get the opportunity to perform our federal mission, we also get the opportunity to do our state mission here locally. And for 2020, you all know that our state mission has been a pretty busy mission. Okay, next slide, please. Okay, so I just wanted to show this slide to show this is our footprint. So you can see a blow up of the metro area and then in the outstate area, but all of these locations are either armories, air bases, maintenance facilities, Army aviation maintenance facilities, or an area where we are present in the local community in the state of Minnesota. Okay, next slide. Okay, these are actually General Jensen's priorities. My priorities are rolling out here shortly. Not a significant change left or right. My number one priority is people first, which was started under General Nash and Lieutenant General Jensen. Simply put, they are our most important resource. Next slide, please. Okay, we got to take care of our people. As I said, they are our most important resource. My vision is treat people with dignity and respect. We want equity in our soldiers and airmen, and we want to be a representation of the communities that we serve in. So we want our ethnicity to mirror what we have in Minnesota. As I said, they're our most important resource, and I hope that soldiers and airmen in the Minnesota National Guard feel good about the service that they're providing for our state or our nation, and they have pride in the organizations that they serve in, which will in turn hopefully wants them to continue to serve this great state and this great nation. Next slide, please. Okay, one of the tenets of taking care of our people is leader development. So ensuring that our soldiers and airmen get the proper education as they advance in the grade and opportunities to lead and develop as they move upward in their ranks. Okay, next slide, please. Okay, organizational safety and security priority. This is something that we take very seriously. You know, some examples of areas where we have succeeded in this during 2020. Our first Armored Brigade combat team deployed over 4,000 soldiers from the state of Minnesota to the National Training Center, and they did it safely. They were the first training rotation in the COVID environment, and we were able to do it safely and effectively, mitigating the risk of not only the COVID, but the safety measures, training in this austere, harsh environment of the Mojave Desert at Fort Irwin, California. Additionally, we've got our cyber protection team that is deployed to our national capital region, supporting its federal mission in cyber defense of our nation, supporting the national defense strategy. As you all know, we mobilized the entire National Guard in response to the civil unrest from the death of George Floyd, the end of May into June. And fortunately, we were able to do this safely without any significant injuries to any airmen, Army soldier, or civilians. Okay, next slide, please. Okay, fiscal property and responsibility. Bottom line is we're prudent with our resources. When we ask for resources from the state, we think about it before we ask, and we have a well thought out plan to spend the money efficiently. Most of the money that we ask for from the state, we have a federal match to it, so we get 2 for 1, so to speak. And a lot of the funding that we receive from the state is not only not only goes to benefit the Minnesota National Guard, but also our partners that we work with. So many of the things up at Camp Ripley benefit the Department of Transportation, the State Patrol, Department of Natural Resources, and other organizations that use that training facility, as well as renovations that we do in some of our community centers. You know, they benefit the community as well as their soldiers that work in those communities. Okay, next slide, please. Okay, communicate and partner. We have relationships that we form, and these allow us to do our mission better and to partner with other people. We have partnership with as I said, with the Department of Transportation, the Minnesota Department of Veterans Affairs, Commissioner Herkey, to provide benefits for our soldiers and airmen, the state police, our state patrol, DNR, as well as we partner with diverse organizations in the community. We have emphasis councils where we partner with Sia-Her and the Asian Pacific Islander community to promote diversity in our ranks, as well as the JCRC and other organizations across the state. Additionally, we partner within the 34th Infantry Division, aligned for training, different organizations that are part of the 34th Infantry Division in other states. We partner so that they can benefit from some of the training that we do within the division, so that their soldiers can come and support and have opportunities to come to Minnesota. As well as we have the longest running partnership program with Norway, the Norwegian Troop Exchange, which unfortunately during 2020, we're not able to do that because of the COVID pandemic. And we are not going to be able to do that in 2021 either. Hopefully at the end of the summer, if the vaccine is effective and we get back to some sense of normalcy, we'll do some small scale event with Norway. As well as this summer, we will celebrate our 25th anniversary with our state partnership program with Croatia. And again, hopefully we'll be able to do some things in the second half of the summer, if we're able to get back to some sense of normalcy post-pandemic. Okay, next slide, please. So this is COVID-19. We've done a lot of work for the state in response to COVID-19. We started out doing some warehousing initially to organize the personal protective equipment when there were shortages, and we've turned most of that over to the state. But we right now we have nearly 500 soldiers and airmen on 502F orders, supporting testing, community-based testing. We right now, as of today, we don't have any service members in long-term care facilities, but we did have service members in long-term care facilities providing care for the residents when, due to the pandemic, their workforce was depleted and we needed to go in and help care for the residents. We are planning with the state for the vaccine plan, and although we're being used just sparingly on that, we may have to fill some critical gaps in that as the vaccine becomes hopefully more available in the coming weeks or months. So that's what we've done in response to COVID-19. As I said, we were in the long-term care facilities, and we still have some soldiers that are prepared to go back in the long-term care facilities if the need arises. We partnered with the Minnesota Department of Health and put on about a 3.5-day training program, training our soldiers and airmen to care for the residents in these facilities with dignity and respect and base understanding so that we could provide this service. If you would ask any of these soldiers and airmen if they ever envisioned that they would be providing long-term care for residents in some of these facilities, I don't think any of them raised their hand when they joined the Guard and thought that they would do that. I'm happy to say a lot of them feel a sense of accomplishment and a sense of pride in what they're doing for the community, and have established some relationships with some of these residents and been able to better themselves and are happy to get back to their community. Okay, next slide, please. Okay, in addition to the COVID-19, we also have, it seems like every year the Red River Valley or the Red River of the North floods. Last year in the spring, we were up in Oslo. 2020, we responded to several winter storms, opening up our armories or using our SUSBs to help retrieve stranded motorists and get them in the armories. This past, just recently, we had one event with that as well. Next slide, please. Okay, and of course, civil service response. Unprecedented year where end of May, early June, unfortunately, we mobilized the entire Minnesota National Guard in response to the civil unrest surrounding the death of George Floyd. Since then, we have mobilized in 2020 4 other times for a total of 5. Fortunately, some of those times we did not have to leave the Arden Hills Armory, but we were there as an insurance policy for the state. And then right now we have soldiers on state active duty supporting the security of the Capitol for the inauguration that's coming up. Okay, next slide, please. And as I said, we had over 7,000 soldiers and airmen on state active duty in the end of May, early June, in response to the civil unrest surrounding the death of George Floyd. Okay, we do all of that, and we have done all the stuff in the state and the community, as well as what we've done for our federal mission. So these excerpts here are from, they're out of our annual report, and we'll get an annual report over to you later this month or the beginning of February, as soon as we get them back from the printer. But in addition to our state report, our state mission, we've done a lot of stuff to get ready for our federal mission. As I mentioned earlier, our 1st Armored Brigade Combat Team went to the National Training Center and executed the first National Training Center rotational mission in the COVID environment. Our Expeditionary Combat Aviation Brigade recently returned from a deployment to CENTCOM, where they were in Iraq, Kuwait, and Syria. And they returned right before Thanksgiving. We're glad to get them back. And as I'm talking to you today, we have our 177 Cyber Protection Team in the National Capital Region supporting cyber defense of our nation. Our 34th Military Police Company is at Guantanamo Bay, I'm sorry, and 2 of the 135 Infantry Regiment is in the Horn of Africa, and we have one of our field artillery units in Afghanistan doing its federal mission in support of the National Defense Strategy. Next slide, please. And on the air side, we've had some smaller deployments in 2020, but you know, we had the mission where you see the 2 F-16s flying over for the COVID first responders and healthcare workers, as well as we've cycled out of the 133rd Airlift Wing over in Minneapolis, St. Paul, some humanitarian lift that has gone to other countries. So that's some airmen doing those tasks. And that's all I have for you, Chair, pending your questions from your committee.
Thank you, General. And I know last summer when there was when you were getting ready to go to the national training deal out in 29 Palms, which, by the way, General, I spent some time in 29 Palms back in my Marine Corps days, so I'm familiar with it.
Yes.
And thank you. There's questions and concerns with not knowing what was going on with the whole COVID response and what was happening with keeping our citizens safe and that sort of thing. I'm glad to hear that we were able to execute that mission without any trouble or illnesses or that type of thing to happen to our troops. That was good to hear. One question I have, and I know I see Representative Edelson has her hand up, but is Camp Ripley getting much use from non-military folks as far as taking in some revenues, or I imagine that has slowed down quite a bit here in this past 10 months?
I think the whole COVID environment has slowed down some of the stuff that happens at Ripley. I mean, everything it seems like is done in more of a smaller scale, so it's probably not used as much as it has in past years. I know the State Patrol is getting ready to launch another academy, so I know it will be used for that. They're a heavy user up there. I don't think the Department of Transportation used it this fall for their snowplow rodeo, for lack of a better term. And I think that's because I think it was done on a smaller scale. But the DNR still uses it for some of their stuff. And I guess I would maybe defer to Mr. Kerr and see if he knows. Otherwise, we can certainly get that information back to you, Chair.
Thank you, General. Representative Edelson.
Thank you, Chair, and thank you, General. I just had a follow-up question. I just want to thank the National Guard too for all you've done. It's been a busy year. It has. So I actually, and also just want to compliment, I took my COVID test at the Bloomington location, and there were National Guard members there, and they were so kind and friendly. I was trying to recruit one of them to work at our Edina fire station. So just if you know who that is. But I wanted to, with the long-term care facilities, just curious, do you know how many long-term care facilities you actually staffed, and how long did that what did that look like? I would just like a little bit more information. About that.
So
General.
if a long-term care facility got to a certain threshold, and we wanted to say they got to about 70% of their staffing, then it was viewed as a critical. So we would go out and do an assessment of this facility, and then we would share that information with the Minnesota Department of Health. And then they would say, yes, we want you to go into that facility. Most rotations lasted about 2 weeks. So that in 2 weeks, we would have our service members go in there, and all of them consisted of at least one nurse. And then most times medics, which are our combat medics, our 6 to 8 whiskeys are on the air side, our med techs. And then all of the soldiers and airmen who had other skill sets went through a training course, like I said, about a 3.5-day training course. And they were certified as not certified nursing assistants, but temporary nursing assistants. And that was that curriculum we got from the Red Cross. It was vetted by the Minnesota Department of Health, and they validated the training. I would have to get you the number exactly. I'm going to give you a number, but I'm not 100% sure it's right. I want to say it's about 18 or 19 facilities that we were in. So, but we will get that over to you.
Representative Edelson.
That's your question. Sorry.
Thank you, Chair. Thank you, General. That actually is very helpful. I would actually just be curious in terms of, we had such a need in our long-term care facilities. So thank goodness for the National Guard in this instance. So thank you.
Yeah, and we see our role in that decreasing. I think most of the long-term care facilities are at least first shot complete, or supposed to be first shot complete by the end of this month. So they should be second shot complete by the end of February for sure. So we're seeing the need for that decline a little bit, significantly actually, but we'll get you the total number over to you.
Thank you, Representative General Mankey. Any other questions? Oh, Representative Detmer, I see your hand up. Representative Detmer.
Yes, during General Mankey, during the riots, you had mentioned you had mobilized 7,000 troops. And do you have a dollar amount on that, what it costs us to mobilize those troops?
General Mankey.
Mr. Kerr, we're going to have to send you that over, but we can send that over to you as well. I don't have the big number off the top of my head, Representative Detmer, but we'll get that over to you.
And
Representative Detmer.
Mr. Chair and General Mackey, how many troops are mobilized now for the state capitol?
So we have about 40 soldiers on right now. We were prepared to bring more on, but luckily the threat didn't materialize for as much as it did. So we're only having 40 on right now. We scaled that back significantly from what we were anticipating originally, but now we have about 40 on. And we anticipate them most likely coming off of state active duty in the next few days.
Thank you. Thank you.
Representative Detmer, fine, okay. Representative Raleigh, did you have your hand up?
Thank you, Chair. General, of these soldiers and airmen that are being deployed, can you talk to us about the implications of posse comitatus and how that's affecting the airmen and our soldiers?
General.
Yeah, so our airmen and soldiers are in support of local law enforcement. They are not, they don't have the authority to arrest. And when they're deployed in the state, they're in a state active duty status, which does not fall under the Posse Comitatus Act.
Representative Raleigh.
Thank you, Chair. One follow-up, please, General. We've been told that there are National Guard soldiers that are deployed to our nation's capital. And one report that I read said that they are being sworn in as officers, or they're being deputized. Are any Minnesota airmen or soldiers being deputized?
General Mankey.
I think all of the soldiers and airmen that are going to the capital region are being sworn and deputized at this time. Yeah, I think I'll clarify that, but I'm pretty sure they are.
Representative Raleigh.
Thank you, Chair.
Representative McDonald.
Thank you, Mr. Chair. Adjutant General, would you say you're better prepared this week at the Capitol for what might happen than you were in the summertime? And if so, what was the definitive factor as to why that would be the case? If that question makes sense.
Sure.
General Mankey.
Yeah, I would say, this is the sixth iteration of putting soldiers on state active duty in support of local law enforcement. So, we have established relationships not only at my level, but also at the platoon sergeant, team leader level with local law enforcement. So there's a more common terminology. It's kind of about one of my tenets of partnership. So we know the local law enforcement knows what our capabilities are, and we know what their capabilities are. So I think we've gained some efficiencies. Soldiers know now what's expected when they come in, whereas when we came in the end of May, early June, it was the first time we did it. So it wasn't as synchronized as it is now. I just think we're a lot more efficient, and we've done a lot more planning at the interagency level between the State Patrol, ourselves, and Department of Public Safety.
Representative McDonald.
Thank you, General. Last question: were there any orders in July that prohibited you from doing the job, as opposed to today?
General Mankey.
I'm not sure I understand the question. Was there any order in July? I'm sorry.
Yeah, just
Representative McDonald could be more specific.
Yeah, well, just in some of the news report that I heard, that there was certain things that the National Guard were not allowed to engage in some of the demonstrators. So I'm wondering if that was true, A, and if so, has that been taken care of for this term now at the Capitol?
General Mankey.
Yeah, I'd say we're always in support of the local law enforcement agencies when we're doing this. And there's restrictions on what our authorities are, but when we're paired up with local law enforcement, the local law enforcement is the authority, and we're supporting them. So I don't think there's any difference from what would have been done in July than what's being done today. I just think we have a better understanding of what everybody's roles is on that team.
Representative McDonald.
Thank you, General, and thank you, Mr. Chair.
Any other questions for General Mankey or Mr. Kerr? I'm not seeing any hand raised. General Mankey, thank you so much. The Minnesota National Guard and Air Guard it provides an invaluable service to the state in multiple ways. I think we've seen that this year from floods to civil unrest to helping out in our nursing homes. I especially want to thank you for the help that some of the troops did going to our veterans' homes. Mr. Hughes, Commissioner Hughes will be talking, one of the next ones talking, and will be giving us a report on that. But on behalf of myself and this committee, I would like to thank the National Guard and the Air Guard for their service provided to the states. Thank you for coming today, and we'll be in touch.
You're very welcome, Chair, and thank you and your committee for giving us time today to talk to you. If there's anything that's needed, just let us know, and we'll follow up on those questions back to your committee.
Thank you very much, and we will let you know on what we need following up. So thank you, and have a great day.
All right, thank you.
Okay, next up on the agenda will be a presentation from the Department of Veterans Affairs, and Commissioner Herkey. He's bringing quite a crew of staff along, so when you speak, please identify yourselves for the record. Commissioner Herkey, if you're available.
Chair Eklund, this is Ben Johnson, Legislative Director.
Ben, welcome to the committee.
Thank you, sir. I appreciate it. I just wanted to give an acknowledgement that both Commissioner Herkey and Deputy Commissioner Hughes are using their phones for audio. They're having some challenges with the computer audio. So if there's any glitches or any challenges, that would be the reason. For the members, thank you for the time. I'm the Legislative Director. I've been with the agency for about 6.5 years and been the Legislative Director since January of 2016. So I'm generally the point of contact, but to kick things off for this session, we wanted to bring in the Commissioner, Chief of Staff, and agency deputies to talk through what we have to offer. So following this presentation, I'm the point of contact, but as of now, you've got them on video. Go ahead, sir.
Yes, Mr. Chair Eklund, can you hear me?
Yes, Commissioner, welcome to the committee. Please identify yourself for the record.
For the committee members, I am Commissioner Larry Herkey. I am the Commissioner of the Department of Veterans Affairs, and I am very pleased to be with you today to have an opportunity to give you an update as it relates to what is going on currently within Veterans Affairs. Just so you know, I see Ben's bringing up the actual slides here. I am going to do a team approach today, and each individual introduce themselves, Mr. Chair, as they start their segment and identify who they are. I'll start out with the first one with the agency overview. Ben, if you go to the next slide. Our agency is responsible for the 312,000 veterans in Minnesota, and our job is to take care of both the veterans and the veterans' families. The numbers of veterans for the new members of the committee have continued to go down based on the average age of our veterans. We have a majority of our veterans that are actually over 65, and those number of veterans continue to get smaller each year. Oh, Ben, did you get to the second slide yet?
The agenda slide is up, Commissioner.
Okay, it's just a little slow on my side. Our computers here in the state system do not like Zoom for whatever reason, but I appreciate that. I won't, since I don't have the mission statement up, I don't have it memorized verbatim, but I can tell you that we represent both the veterans and their families and their survivors. I think that's an important distinction about our agency, that we're responsible for all three. And I think it's an important function that we do for the state of Minnesota. We have a total amount of about so we have seasonal employees, but we're usually between about 1,300 to 1,400 employees, and many of those being part-time. And the majority of those employees are actually in the healthcare area, of which Deputy Hughes will talk about later. I do want to tell you that we are in 55 communities throughout the state, and that what I mean by that is we spend a day in outreach or by some other method at a specific location within communities. So we are in communities weekly, 55 throughout the state of Minnesota. So a large expanse of the state that we cover with our outreach programs and our educational programs, and also, of course, through our homes and cemeteries. A little bit about myself before I turn it over to the Chief of Staff. I am been a member of both the active Army and the Army National Guard in Minnesota. I served for over 30 years. I was deployed to Iraq with the 1st Brigade of the 34th Division, one of the longest deployments for any unit during Iraqi freedom. I got an opportunity to do several different jobs and some I don't know if that was by design, but I got a chance to work through many different areas within the Army, air defense. I got armor, infantry, served a little bit of time in field artillery, and at the end of my career, I was actually working with facilities. So I was responsible for the armories throughout Minnesota, which was a great eye-opening experience to be able to manage 65 armories, I think five or six field maintenance shops, and two helicopter locations that we had throughout the state of Minnesota. So that was a great and wonderful opportunity.
Mr. Johnson, I don't know if we lost the commissioner here or if,
Chair Eklund, that's certainly possible. He mentioned prior to the commencement of the meeting that he was having some technical issues and asked me to just hand it off to the agency's chief of staff, Mike McElhenney, who's next up. So Mike, if you could.
Mr. McElhenney, welcome to the committee. Please identify yourself for the record and proceed. You're muted yet, Mr. McElhenney.
Apologize, Mr. Chair. So, Mr. Chair and committee members, thank you. It's an honor to be here. Where we were at in the agenda is the commissioners just kind of starting to explain the various areas of the agency, but also introductions. As he mentioned, he wanted to show you his leadership team, so our faces are familiar to the members of the committee. And a brief introduction, I've worked at the agency now about 10 years. I was 21 years active duty Army. Was the first U.S. amputee in the global war on terrorism back in December 2001. And I've worked here, as I said, about a decade. So kind of a unique perspective on watching how the military evolved from long wars in Vietnam, your era, Mr. Chair, and to the new, global war on terrorism era, both in the military perspective, but also the veterans perspective and what they go through, what we go through, kind of transitioning back into society, if you will. So it's been a pleasure to work for the agency in the state of Minnesota. As I said, I started off in the communications department. I worked there briefly. I was the legislative director for over 5 years, and I've been the chief of staff now going on 4 years. And my job is to sort of oversee and manage the central office or services of the agency, which supports the missions of the two divisions. So I oversee finance, communications, legislation, legal, maintenance, internal controls, gosh, what am I missing? HR, probably a few more areas that I'm leaving out. So to synchronize all the efforts for the two divisions to be successful is really what I do, kind of jack of many trades, definitely master of none. At this point, Mr. Chair, I'm going to hand it off. What I'll do is I'll kind of go through our slides. I'll talk about briefly our strategic goals, and then I'll hand it off to Deputy Commissioner Lindsay, who will introduce himself and a little bit of his background, and then on to Deputy Commissioner Hughes, who will talk about the healthcare division, and he'll give you a little history and overview of his background. So in the last biennium, we developed a strategic plan, something that I think the agency hasn't had in quite some time. For anyone who knows the history, we were working off a long-term plan to sort of redevelop the Minneapolis campus, and that took some time and brought us to where we are today, where we have a new strategic plan with 4 major goal areas that nest into the governor's One Minnesota plan. And as you can see, the first strategic goal is to ensure seamless continuum of support that addresses the evolving needs of our veterans, and that's both the young ones getting out tomorrow and the veterans that are, kind of getting to the end. So the whole continuum of support. We also want to increase veteran awareness and participation in our programs and services. And that really is a lot of education. That's something that we, like any other agency, struggle to keep up with, to impress upon our stakeholders what it is we do and to come see us and let us help. So major campaigns going on there. We're working very hard to be exemplary stewards of both our financial and our natural resources. So that's something we take very seriously. And then lastly, as with with the general who just briefed, our workforce, our human capital is so important for us to do our mission. And Deputy Hughes will probably talk a little bit about the difficulties with some of his staff. There's national shortages for that important work those folks do. So we're constantly trying to get folks in the door, get them trained, educated, and then keep them on board for the long haul, because it really improves many areas of the agency: continuity, financial costs, etc. So at this point, Mr. Chair, if there's no questions for me in the strategic goals, at this point, I'll turn it over to Deputy Commissioner Brad Lindsay.
Commissioner Lindsay, please identify yourself for the record and proceed.
Good morning, Mr. Chair, committee members. My name is Brad Lindsay. I'm the Deputy Commissioner of Programs.
Commissioner Lindsay, you'll have to get closer to your computer or something. We can't hear you very well. So
I'm going to switch to headset here. Is that better?
that works. Thanks, Commissioner. Please proceed.
Very good. Thank you, Mr. Chair, committee members. My name is Brad Lindsay. I'm the Deputy Commissioner of Programs and Services for the Minnesota Department of Veterans Affairs. Programs and Services, in a nutshell, is there to either advocate and assist veterans in obtaining their federal benefits, or to provide our own unique programs and services to fill gaps in those federal services that we see and can accommodate. Next slide, Ben. So this is just kind of an overview of each of the areas. Basically, Programs and Services consists of 3 divisions: the Veterans Programs and Memorial Affairs Division, the Veterans Services Division, and the Veterans Education and Employment Division. We have a budget of about $23 million per year. We have approximately 100 staff. As the commissioner mentioned earlier, we have a little bit of fluctuation. We do hire some additional temporary and seasonal employees in the summertime in our 3 state veteran cemeteries. One of the major things with our state benefits, the State Soldiers Assistance Program, that I wanted to hit on was the $6.2 million in COVID relief grants that you, the legislature, authorized during the last regular session to assist our veterans. So as I said, it was $6.2 million total. We, as of today, only have $829,000 of that remaining. We set up 3 different relief programs to expend those funds and to get assistance out there to veterans who were financially impacted due to COVID-19. And as of today, we have utilized or have received over 7,000 applications for assistance. And important thing to note is a large number of those veterans were receiving assistance from this department for the very first time ever. So unfortunately, they needed assistance, but gladly they knew where to go, and we were able to provide that. So I personally thank the legislature and this committee specifically for stepping up and making that money available to us. Ben, if you'll advance. So one of the major efforts that we've undertaken since 2014, I guess I forgot to mention kind of my background, but I became the Deputy Commissioner of the department in 2014 under Commissioner Larry Shellito, and was fortunate enough to stay on with Commissioner Herkey now. I am a veteran of the regular Army and also the Army Reserve. I have worked for the department since January of 1999. So actually this week, it'll be 21 years I've been with the agency. I did leave the agency for a 6-year period where I was the County Veteran Service Officer down in Rochester for Olmsted County. I'm actually the first Iraq War veteran to ever work for the agency, as I was working for the agency when I was called up out of reserve status to go to Iraq in 2003. As I said, with a homeless veteran effort in 2014, there had been a call to arms, so to speak, from the secretary of the federal VA, and we decided we need to get serious about addressing the homeless issues in Minnesota. As of about 2010, we were identifying over 600 veterans during the annual point in time count who were homeless. We've reduced that number by over half. This graphic shows you right now there's federal benchmarks that are required to meet what they are calling functional zero for veterans homelessness. And each of the continuums of care, which are areas that are set up by the U.S. Department of Housing and Urban Development, Minnesota has 10 of those. Each one of those has to reach functional zero and have a declaration. And when all 10 are declared, then we have reached functional zero in the state of Minnesota. Right now, we have declarations in 6 of the 10 continuums of care. As you can see, the only remaining are Hennepin and Ramsey, which are by far the largest populations of remaining homeless, and then St. Louis County, and then what is known as the central COC, which St. Cloud, of course, is a large piece of. We housed more veterans in 2019 than we've ever housed before, and we were a little set back with the COVID and all the complications involving that, but we're still doing well. We have a veterans registry where we track veterans. All of our partners, all of the shelters, the Minnesota Assistance Council for Veterans, all of them enter veterans into our registry when homeless veterans are located, and we case manage them from that point. I can tell you today that we have, lost my number, I'm sorry, 297 veterans currently on the registry who are homeless and are seeking assistance with housing. Next slide, Ben. One of the other things I wanted to touch on today is our veteran cemeteries and our opportunity for a new state veteran cemetery. So in 2009, the legislature in session law authorized us to seek funding for 3 new additional veteran cemeteries. Our cemetery in Little Falls, which is right next to the front gates of Camp Ripley, has been in place since 1994. And in 2009, the legislature decided that we needed to expand that and get more cemeteries out in each of the regions of the state, so our folks in greater Minnesota are being served. So since that time, we have received federal grants to build the cemetery in Preston, which we opened in 2016, and then also in Duluth, which was just opened in 2019. This past October, we were notified by the VA's National Cemetery Administration that we had been selected for a grant opportunity to build our last authorized cemetery, which is set to be in Redwood County, Minnesota. The county has been a fabulous partner in this. They have purchased some land that we're in the process of having transferred via donation over to us in the Department of Administration. We've got about a year-long planning process now, and hopefully in October, we will be awarded the federal grant, which has been decided will be $5.99 million, and we can move forward with our first phase. The amount we received this year is somewhat less than we've received in the past. So our plan is for 2 phases, the first of which will be a minimum viable cemetery. We will then look at later phases, or a later phase where we may have some initial or additional asks for state funds to build that out a little more than what the original or initial VA allocation will allow. And also, while I'm on here, to remind you that the federal government provides these construction grants, but the tails, of course, are on the state and the department. So it takes about 2 years for our construction to be completed, and then we will be looking for some operating costs at that time as well. And I believe that is all I have for you today, Mr. Chair, committee members. I will now pass it along to Doug Hughes, our Deputy Commissioner of Veterans Healthcare. Thank you.
Welcome, Commissioner Hughes. Please get yourself a name for the record and proceed.
I'm back on. My name is Douglas Hughes, and I'm on my phone. So, Chair, if you can just raise your hand if you can hear me to let me know that I'm coming through. Can you hear me?
I can hear you just fine, Commissioner.
Okay. Okay. My name is Douglas Hughes. I'm the Deputy Commissioner for the Healthcare Division, the Minnesota Department of Veteran Affairs. I've been in my position for about 4.5 years. I spent over 20 years on active duty. I was a military advisor in El Salvador during their civil war in the 80s. After that, I spent approximately 10 years in the pharmaceutical business in Latin America. And then I went to the federal VA where I managed home and community-based services, and then in the position that I'm currently at. In the state of Minnesota, we have 5 state veterans homes that provide 24-hour nursing care, both in a skilled nursing setting and a domiciliary setting. Skilled nursing facility, everyone is familiar with, that's generally a nursing home. And we also have the domiciliary, which is licensed as boarding and care or housing with services. I'll get to the numbers here in a little bit in locations. We also have the adult day on the Minneapolis campus, which is only one of 2 programs in the country that has adult day. And in addition to that, we have the only on-site dental clinic in the country on a state veterans home. Currently, we have approximately 650 veterans in our homes. We have a total capacity of 724. However, with COVID and some of the restrictions that we've had, we have to have isolation areas. We're very restricted on when and the amounts that we can admit. So we are down, but as soon as we are able to begin admitting, we will begin doing that. We have received many awards, even in the time that I've been here, for our care and for our innovative programs. And we've also begun leading an effort as an agency for the efforts for veteran suicide prevention. We have 5 locations in the state of Minnesota. Minneapolis is a 300-bed skilled facility. Currently, the capacity or the census is 260, Laverne 85, with a capacity of 71. Silver Bay, which I just left, I'm sitting in a car right now in Duluth. That has a capacity of 83, where our current census is 69. Fergus Falls has a capacity of 106, and right now we're sitting at 90. The domiciliary program in Hastings has a capacity of 145. We have 123, and in Minneapolis we have a capacity of 50, and we have 36. We do provide high quality care, and as I mentioned before, we have been the recipient of several awards. All of our homes are high performers, 4- or 5-star facilities in the state of Minnesota. We have passed I should say very well to excellent in all of our state surveys, whether it's the Department of Health or the Department of Health acting as the Center for Medicare and Medicaid, or the federal VA. So we get surveyed, the term is called, by those two regulatory bodies, and we have done our surveys very well. During COVID, we have been surveyed countless times in our homes, and I can tell you that except for one finding in each place about perhaps a staff member not washing their hands or something that we debated, we have come out very well. So now I'd like to talk about our new state veterans homes. We have designed 3 veterans homes, 72 beds in Bemidji, 72 in Montevideo, and Preston 54. And the reason for those numbers is because the design led to that, as well as the populations in that area. Except for Preston, we did not have enough funding to do the 3rd wing for the facility. So we had to come down to 54 beds, but those are for various locations in the state that if they were to be now authorized for build, we would have pretty much a circle around the state of Minnesota. We're waiting for grant approval from the VA Federal Construction Grant Program. We need approximately $79 million. We were not selected in 2020. We're hoping for selection in 2021. The only issue that we may run into is that if construction costs have increased significantly, we have already value engineered as far as we possibly can in all three of the facilities. So there may be additional funding needed should we be approved this year. Also, I would like to thank the legislature for the $11 million in asset preservation and the funds that came from the excess of the bridge funds. I can tell you those will be put to good use. Many of our facilities have age on them, and those can all be put to very good use. The next slide is the Healthcare Division Suicide Prevention. It's still fairly new. Last year, when we began efforts with suicide prevention, is right when COVID hit. We actually had one of the federal VA leaders in the Governor's Challenge effort, is what it's called, from the U.S. Department of Veterans Affairs, actually had to leave the meeting in Minneapolis because he was being recalled to Washington, D.C. at the beginning of COVID. So that has created a lot of challenges for us. And I know that we have a supplemental budget ask for the Veteran Suicide Prevention Initiative that's out there, that's going to be put forth. And what our effort is really to combine efforts for the state of Minnesota with all the other efforts that are in the state. Our goal is to reach 0 veteran deaths by suicide by 2035, and reducing that along the way, hopefully 1 veteran at a time. Next, the COVID-19 response. I said this in the other briefings. I can tell you that we have been totally consumed by COVID-19. And I can say that I believe our efforts have led to a very decreased amount of deaths and serious illness that could have occurred because of our efforts. The senior leadership team that I have and we coordinated the 5 veterans homes even to a greater degree as really one entity, so that we shared resources between all 5 locations. We deployed senior staff to the locations to assist with strategic planning. In addition to that, we had staff deployed from not only one veterans home to another, but also programs and services. We just came from the Silver Bay Veterans Home, where Frank Seaver, who works for Brad, is there. I saw him with a tray in his hand serving a veteran there. And as far as we had one National Guard, his name was Corey Johnson, and he worked at the Silver Bay Veterans Home. If you look down the slide there, you can see all of the things that we have done. Unfortunately, we have lost 27 veterans to COVID-19, but we're very fortunate that we had no shortages of PPE. We had no shortages of strategic and thoughtful planning that really guided us. I can tell you that we really have some experts in the area of infection prevention that really guided movement of positive COVID veterans around the facility to ensure that they were well cared for and didn't pass the disease on to other residents or staff. Next slide, please. The COVID-19 vaccination. We have already done round 1 of the vaccination. We'll be having our next round of vaccines beginning in approximately a week, when the veterans homes will be giving vaccines to both staff and residents. For staff, we have a contract agencies that's providing the majority of staff vaccines. And I can report right now that our overall vaccine rate is 82.7%, with 93% of the residents being vaccinated and 76.8% of the staff is vaccinated. Our high for staff vaccination is 82% in Minneapolis, and 59% is our low in Silver Bay. As I mentioned earlier, we do have some shortage, or we have some open beds in our facility. I can assure you that we've been asked for the numbers on the waiting list and how long they have been. I can tell you that because of COVID, we've been unable to admit at the pace that we would like. But as soon as we get vaccinated, as soon as we're able to not have isolation areas set aside in our buildings, that we will be admitting as fast as we possibly can. We know that we have veterans and families that are struggling in the community, and our goal is to serve them. And I can tell you that as soon as we are able to, we will begin fast admissions. I can tell you, though, that as we are able to admit, we are admitting. However, for example, in Laverne, we can only admit one veteran per 14 days because of the physical layout restrictions. We can do much faster in Minneapolis. We can probably do about 4 to 5 per week. But when we have an outbreak there, which we did, then those admissions slow down. So barring any questions, I'm assuming at the end, I will turn this back over to Commissioner Herkey to finish us off.
Thank you, Commissioner Hughes. Commissioner Herkey, are you, I'm assuming you're back with us. So if you have any other final comments, and then we'll go to questions. Maybe Commissioner Herkey's still having technical issues. We'll go to questions, and if he can come back on, we'll get him on here. Thank you, everybody, for the
Mr.
staff. Oh, Commissioner Herkey.
Mr. Chair, can you hear me now?
Yep, we can hear you, Commissioner. Please proceed.
Yeah. Yes, Mr. Chair. There's 3 different mutes here that I have to deal with to talk to you. But sorry that my introduction got cut short, but the staff did a great job finishing up. There was one additional item that I wanted to bring up, and that was this upcoming year will be the 20th year for the 9/11 GWAT participants that were participated in that. That was 20 years ago. That'll be September 11th of this year. I've created a task force, and I know Mr. Chair knows about it because he's a member of the task force and he's helping serve on it. But I just wanted the rest of the committee to understand that there's a task force out there. We're working on the definitive history as it relates to the war, which included about 45,000 Minnesotans. So it's a significant amount of our population that was involved over these 20 years. And we would like to make sure that we commemorate the time period, but we also are able to capture the history and so forth. So we're working with TPT and others in the Minnesota Military and Veterans Museum to make sure this is a team event going forward. The last page is depicted there, indicates the different contacts for the Minnesota Department of Veterans Affairs. All of these are very, we have close contact with the CVSOs throughout Minnesota and also through the veteran service organizations of which we attend and actually assist the Commander's Task Force. And with that, we'll stand for any questions that you might have for us, Mr. Chair.
Well, thank you, Commissioner Herkey. I appreciate the update, and I appreciate working with all your staff. I do have a couple of questions, but I see Representative Detmer has his hand raised, so I will go to him first. Representative Detmer.
Yeah, thank you, Mr. Chair. And a question for Mr. Hughes. I know you guys just do an outstanding job with our veterans in our 5 veterans homes. What is the average age now for our veterans in our veterans homes, if you have that?
Generally, the average age, Chair Eklund, Representative Detmer, the average age is generally about 83 or 84 years old in all of our veterans homes. That's different in the domiciliary program. That age is probably in the mid 70 range, but we do have some veterans that are in their 40s, and we do have veterans that are in their 80s in the domiciliary program.
And Mr. Chair.
Representative Detmer.
And what is the oldest person in our veterans home right now? And maybe
Commissioner Hughes.
Chair Eklund, Representative Detmer, I don't have that on the tip of my tongue right now, but I know we have some that are approaching 100, but I don't know that we have any 100 years old currently in our facilities. We had one who was a Pearl Harbor survivor, but he moved to California when he was 101.
And Mr. Chair,
Representative Detmer.
the range of veterans that we have, how many World War II veterans are still with us? And then you go down to Korea and then Vietnam. We see more Vietnam veterans coming into the homes now. How does that break down?
Chair Eklund, Representative Detmer, I don't have those numbers in front of me, but I can tell you that our World War II veterans are very few in each of our homes. I know that we do have some in all of our homes except for the domiciliary program, but that's just a handful. We do have some Korean War veterans, but that's probably not much more than our World War II veterans. The vast majority are Vietnam veterans. And then we have some who are after Vietnam who had suffered some sort of trauma during their service. And so we have one gentleman, I believe, in Minneapolis, who's in his late 40s, who suffered extreme trauma that we are taking care of.
Thank you, Mr. Chair.
Detmer.
Yeah, thank you.
Representative Greenman.
Mr. Chair, and I am not sure if this is to Commissioner Herkey or Mr. Hughes, but I just first want to start by thanking you. The Minneapolis VA healthcare system is in my district, and I hear from veterans who utilize the services and also from healthcare workers who live in my district about both the care that you provide and also specifically during the pandemic, the seriousness and the work that you've done to make sure that both the residents and the healthcare workers have what they need and are safe. On that, I was just in terms of the vaccinations, wondering what the timeline was for both the Minneapolis facilities, but also around the state for folks to be fully vaccinated, and how you think that that'll impact sort of visitation, and particularly at the healthcare facilities and the homes.
Commissioner Hughes.
Chair Detmer, Representative Greenbrier, I think as it is, I can only see your part name here, I'm sorry. We still offer compassionate visits at our veterans homes. If you have a resident there, if your family member is on hospice or on comfort cares, or if there's, for example, if there was a relative that came in around the Christmas time, we did allow those. If they would have to be in full PPE, they had to get checked in at the front door, they had to do all those sort of things. And there were numbers that were limited because we know the only way that COVID gets into the building is from the outside. So we really did have to limit those. As far as what they call essential caregiver visits, we have a plan to bring those back into total visits. I know that it depends on the facility where we have those visits. I believe in Minneapolis, we will begin those visits maybe in the next few weeks, if possible, because we will have the second vaccine in, as I said, next week. Full vaccine antibodies generally is about a week after that. That still does not prevent us from wearing PPE and all those precautions and those sort of things. But we really have to have our numbers come down, and that county percentage really is one of the key factors, because we look at that county percentage every week that it comes out from CMS. And so we're hoping that, like I said, after a couple of weeks, we can really start to gear up visits. But we've had in-room visits. We've had visits in the community room in Building 19 in Minneapolis. I've seen several of those going on. It's just that we can't do them at the pace that we were previously.
Representative Greenman.
Thank you. And thank you for all the work you're doing.
Any other questions from the committee? I'll go here, but my first comment is to Commissioner Hughes. You don't toot your own horn enough, Commissioner, because a lot of people don't know that you were pulling double duty during this crisis and also working in the Veterans Home besides your job as Commissioner. So from me, thank you for doing that. I certainly appreciate it. Commissioner Lindsay, can you give examples to the committee on what sort of assistance was given out through the Soldiers Assistance Fund for that money that we appropriated last year as part of the COVID response?
Yes, Mr. Chair, absolutely. Thank you. So as I said earlier, we had 3 different types of grants. The first one we called a disaster relief grant, and it was basically anyone who was financially impacted in any way could get a $1,000 grant from us. The second was, if you're familiar with our regular state soldiers assistance program, we have what we call a special needs grant, which is a once in a lifetime benefit for such things as someone's furnace may go out or their roof needs replacing. It's a major event that they just can't afford themselves. We can assist with. Because of the nature of COVID and people losing their jobs and having reduced hours and childcare expenses and stuff, we decided to create a second special needs grant that was specifically related to COVID. So maybe your hours were reduced and you weren't able to pay your mortgage for a month or two. You could come to us, and if it was due to lost work or something else related to COVID, we could pay to catch up your rent or your mortgage or whatever, up to a $3,000 grant maximum on that. Those are paid directly to the creditor. And then the last one, as the crisis sort of developed, initially the big issue was the work stoppages and the stay-at-home orders and reductions in hours and things like that. But that was kind of at the end of the school year and going into the summer. When it came time for school to start again, we started seeing the issue of people who may have had a job or have a job, but they couldn't go to work, or they had to reduce hours specifically because of needing to care for their children who were on distance learning. So we called that one the Distance Learning Support Grant, and those grants were up to $3,000 as well, and could help with things like tutors and daycare, or just like I said, due to reduction in hours and loss of income and things like that.
Thank you, Commissioner, and I knew some of those things. I just wanted to make the committee aware what that legislation went for last year. And as everybody here knows, our veterans are a proud group, but they need help once in a while too.
Absolutely. Thank you, Mr. Chair.
I'm not seeing a whole lot of any other questions from members. Commissioner Herkey, you and your staff are to be commended for the great work you've done over these trying times with through COVID and the other things that we've been working through. So thank you for that. And I look forward to working with you and this committee as the budget process goes forward. So thank you for your time, and thank you for putting this presentation together, Commissioner.
Thank you, Mr. Chair.
All right, members and staff, our next meeting will be on Wednesday, January 20th at 3 o'clock. And the plan is to get several presentations from different Minnesota veterans organizations for us to hear what the work that they've been doing. Also, Committee Administrator Travis Reese and I have been working on the rules. We should have the rules come out for you folks to review for how the committee structure will work, and when we start hearing bills in the upcoming committee meetings. So does any of the members have any questions for me at this, for myself or staff at this time?
Yes, Mr. Chair.
Representative Detmer.
While everybody is with us, they might want to tune in on Monday, February 8th. We'll be having our first MAG meeting. It's a military action group. It's a nonpartisan group that comes together from different organizations. I know you've been part of that too, Mr. Chair. And that will be on Monday, February 8th at 9 a.m. And if you haven't been on our list, or if you might want to just give my office a call, Rebecca, my legislative assistant, can get you on the list. Make sure that you, all we need is your email list. And John Huckquist, he will be providing the Zoom for us. So it's going to be a Zoom meeting on the 8th at 9 a.m.
Thank you, Representative Detmer. Why don't you get that information to Ms. Doyle, the committee legislative assistant. She can send it out to those that may be interested in joining in on the MAG meeting.
Okay, I'll have Rebecca do that.
Thank you, Representative Detmer. Anything else before we adjourn? With that, thank you, members, for your attention. We'll have, like I said, we'll have presentations tomorrow, and expect to start hearing some bills from either labor or veterans next week. With that, we are adjourned.